When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Dr. Raj.
Dr. Raj. Dr. Raj Dasgupta.
The most interesting pulmonologist in the world.
Welcome to the Dr. Raj Podcast, a show all about empowering knowledge, addressing difficult topics, raising awareness, and being positive. Dr. Raj is a quadruple board-certified physician, associate professor of clinical medicine, and the associate program director of internal medicine residency. He was a co-host on the TNT series Chasing the Cure with Ann Curry, as well as a regular on the TV show The Doctors. And now, here's our show.
Hi, and welcome to the Dr. Raj Podcast. And what is this a podcast of? A podcast of happiness and wellness, amazing people, great stories. And today we have Lance A. Slatton, a CSCM known as, I kind of love this, the Senior Care Influencer. Kind of love that title. But Lance is a writer, author, and healthcare professional with over 20 years of health in the healthcare industry. Lance is the host of the award-winning podcast and YouTube show, All Home Care Matters. This is a show devoted to helping families, caregivers, and their loved one navigate long-term care issues. He is also a senior case manager at Enriched Life Home Care Services in Lavinia, Michigan. I love Michigan too. Lance was also named a 50 under 50 for 2023 and received the distinction as a top influencer for healthcare and advocacy in 2024. Lance is also a columnist for multiple healthcare and news websites and granted, I could go on and on. Lance, how are you doing today?
Wonderful, Dr. Raj. Always good to see you.
Definitely. You know, I wish we do this video. I know mine's only the audio, but don't we have the best hairstyles in the whole world?
We do. We do.
I'm telling you.
I mean, yes, same barber and everything.
So for those who don't know, Dr. Raj has no hair and neither does Lance. And we almost could be brothers, but you know, I had the cooler tan. You know what I mean? I'm sorry.
Definitely.
You're a little pale.
Yes.
So, okay, I'm going to get started. I got some questions. I think you're going to love these. So, you know, you're in an industry that is near and dear to my heart because your industry deals with just helping people, helping families, caregivers. You know, for my followers, you know, my dad had Alzheimer's. My mom's the number one caregiver in the whole world. So this is, and interviewing Lance is important to me. So I want to know, how did you become involved in this caregiving space in this industry?
Yeah, well, you know, another thing we have in common, Dr. Raj, is the fact, you know, you kind of got into it because of your father. I got into it because of my father. Our stories kind of diverged a little bit. I was pursuing medical school. You entered and completed it. And at the time, my wife and I, we were newlyweds. And, you know, she got her bachelor's and she's had the same very good career for the last almost 20 years now. I was still completing mine. And we get a call from a home healthcare nurse. Unbeknownst to us, you know, my parents had divorced when I was young, that she was going to visit my father. And she said, you know, I have a lot of concerns. He had a really acute sacral infection that developed because of an abscess. It led into osteomyelitis, and he actually had part of his sacral shaved off. And she says, you know, we come and change it 2 to 3 times a week, but you know, in that area, you're going to need it more than that. And she goes, and this is nothing against your dad. He's physically fine, cognitively fine, but logistically, you just can't do that area appropriately, right? And she said, so we're trying to prevent, spread of the infection or a recurrence of the infection. Here's your options. He could either come live with you and your wife for a couple of weeks, or we'll have him go to rehab for a couple of weeks just to get it healed up properly. And we said, well, no, of course he can come live with us. Never knowing how that was going to change my life. So he moved in with us.
Yeah.
And, at that point, though, because of the lack of appropriate care he was able to give it, no fault of his own, he ended up having to have another surgery. And when they got in there, the osteomyelitis, infection of the bone, it had spread. And that led to 7 more major intensive surgeries. I mean, I will spare the audience the graphic nature and details, but I'm sure they can use their imagination. It ended up being now 2.5 years, 7 days, 24 hours a day. I mean, I was doing student teaching at the university. I was working in the labs. I was in charge of our medical fraternity. And I'm running home like, like I was just on overdrive.
Yeah.
And never once, though, did the surgeons, social workers, physical, occupational therapists, wound care nurse, aides, nobody ever said to us, have you looked into any resources or support for you guys? And they're staying in their own lane. If you have a cardiologist, they're not going to probably talk to you about, neurological illnesses because that's not their area. But something like that, it's more social and it's more supportive. And so that experience really was starting to get to me. And so I went to have lunch with a good friend of mine. And in the hallway of his office building, there was a home health care company that was hiring. So I'm thinking, okay, you know what? I'm a newlywed. I would like to make more money than the minimum wage that colleges love to pay students. So I stopped in. I asked the person at the desk, I said, what are you guys hiring for? Because I went through paramedic training just to kind of pad my resume when I go to apply for medical school. The gentleman had no idea what they were hiring for, what the qualifications for. I mean, zero. And I just kind of left there scratching my head. And I get in the car, and on my way home, it just kind of hit me like a light bulb. And I called my wife. I said, you know what? I have an idea. What about we start a company where we send people into the homes to help out people like us, what we're going through? I'm sure there's countless ones out there. And I don't know about you, but my circle, in the university, caregiving, home care, that wasn't anything ever discussed or, you're talking about residency, internship, your MCATs, all the. And so I thought I invented the wheel. I literally thought I invented the wheel. So we soon discovered, there's franchises, there's a whole industry out there. And so long story short, that's how I got into the space because of my personal experience. It was never motivated by a business opportunity. It was, I'm looking for a way to help. And I'll say one last thing. I talked to someone a few weeks ago on All Home Care Matters, and he was a physician like yourself. And he said, do you regret it? And I said, regret what? He goes, do you regret not going back and, pursuing your MD? I said, honestly, it never even crossed my mind. He goes, oh, wow. I said, because for me, it wasn't about the title of doctor. It wasn't about any of that or the prestige or, for me, it was, I simply wanted to help people. I said, so when I got into this area, I quickly discovered, wow, I'm still helping people in a meaningful way. That's still a heavy healthcare component. I love it, and I feel like for me, at least, I'm able to help people on a different level than if I would have done medical school and gotten the MD, because, we've been invited to funerals. We've been invited to birthday parties. We still get cards from families years after we've helped their loved one and they've passed on. I just for me, that was what it was about, looking at how I can help people on a grand scale in a meaningful way. And I found it with what I do.
I love it. And I'm going to say that because, I was chatting with you yesterday, everyone. I was on his podcast and he was so gracious. We have so much in common because I think you've been a great doctor. I really mean that.
Thank you.
And I love your demeanor. I love your PR. And you know what else we have in common? I did the EMT stuff to kind of buff up my resume going in there. So we were parallel until we diverged. You know what I mean? We were right there. And, I truly feel, and I said this yesterday and I'll say this today, what, most of my patients like about me, what I like about you is not that you could rattle off, memorize factual knowledge. Many of us can do that. Right. It's how you treat people. And it's those skills, whether you work at a Circuit City or you work in healthcare and helping people to make sure their decubitus ulcer doesn't get worse, that's touching people. That's helping people. So I dig you. But
Thank you.
I do want to cascade on that first question a little bit. So, okay, you're in the industry. So what have been some surprising things that you've learned about being in that field and that you wouldn't have expected?
One of them is the lack of insight and knowledge that the healthcare industry proper, I'm talking your hospitals, social workers, understand about the home care industry and what family caregivers go through. One of the disappointing and surprising things is nothing much has changed since I was going through that in my early 20s to the present day. We'll talk to a social worker, will call us from the hospital and say, Mr. Jones is being discharged at noon today. We're sending over his file and, his Medicare information. And we're like, but we can't take Medicare. No home care company can take Medicare. And then we're educating her. That to me is very surprising. I wouldn't have expected that, at least all these years later, when it's become a lot more prevalent, especially during the COVID years, where it seemed like home care was like a newfound, national resource for families. So they're not having to stand at that window in the middle of the cold in Michigan, especially, and wave and say hi to mom or dad. And that's their contact, So that was very surprising. And it still surprises me to this day that people just aren't aware that it's such a valuable resource that's available. I don't know about in your experience, but we've had so many families where the doctor's ready to send them off to rehab. And it's not for, a specific health issue. It's because, well, mom lives alone. So I'm going to put her in for a few weeks, let her get a little bit stronger. Then she can go back to her house. Why not give them the option? Well, you could hire home care to come in the home to help her.
Yeah.
Or I could order home health care and they could come to do the rehab. People still aren't, I don't really know how it's viewed necessarily from your side because I'm not on your side, but I don't know how home care is actually viewed, why it's almost like the last resort, or it's not even thought of when it's such a good resource that could help reduce readmission rates, make sure people are following up with their doctors and not missing appointments, taking their medications as prescribed, eating nutritious meals, having fresh groceries, all of these things, but they would just be content putting them into a facility rather than that other option. But that's, that surprises me.
No, and we could do a whole another podcast on this because I got you. I think that, and I'll just talk about myself. I never realized the lack of knowledge I had, because you're attending, hey, you're dealing with inpatient issues. Hey, is the pneumonia resolving? Did we get them off pressors? But when I say discharge, that's such a broad word. I mean, does the medical student, resident, fellow know what a hospice is? What a skilled nursing facility is, a SNF? What's the difference between going to acute rehab and a subacute rehab? I mean, these are huge things. And you said home health. Do we even know that exists? And how do we get there? You know what I mean? Right. And maybe the time in rehab is because they could really are able to exert themselves a certain amount of time a day, but maybe they can go back home once, that's done. So it's hard. And I don't know why there isn't education about this, but right now I'm the associate program director for internal medicine residency. And, being an internist, that's one of the most important things is that transition from the hospital to the home. And I wish, there was more education at every level about it, but you're right.
Yeah,
you're right.
Absolutely.
All right. So I know you're the big cheese. I know you're the senior care influencer, but let's talk about your home care company. What is your role? What do you do there actually?
Yeah. So I'm a senior case manager. And what that really means is I meet with the families, I meet with the loved ones. We've met with people in the ICU, we've met with them in the nursing home, assisted living, or in their own private living room, or sometimes families will want to come to us. We leave the option up to them and we do a full assessment. We do a full intake. I equate it because, again, this goes back to education. We'll have a sister who lives, we're in Michigan. So we'll have a sister call and say, I'm handling this for my siblings, because they're there on the ground in Michigan. I'm doing what I can. We need to hire you to help start taking care of mom tomorrow. Can you send somebody? And we'll say, well, It's not that simple. I said, no more could I call a surgeon and say, I need surgery tomorrow. I'll be there at noon. I said, but that's how they look at it. And so we tell them it's a full intake, just like when you go to that doctor for the first time. We get your medical history, we get your advanced directives, your DNR status, your whole, list of medications that you're on, list of medications that you're allergic to. It gets down to what time they like to eat their specific meals, to what they like to have for those meals, to the things they don't like, and everything in between, so that we can put a comprehensive care plan together, because we want it to be as minimally disruptive as possible for when our staff come into that home to help take care of your loved one. Because for a lot of them, it's the first time having a strange person in their home, which is kind of, that's your private area, that's your sanctuary. And we also don't want the elderly, and it's not just elderly, we help people from 0 to 100. But for adults, we don't want them to feel like we're coming in there in a nanny state, taking over and telling them what to do. You're still king of this castle. We want to help you remain the king of the castle. If you're supposed to take, X, Y, and Z at noon, we're going to remind you to make sure you take them, because if you miss them, maybe it's going to have a detrimental effect and you'll have a setback, or you might end up having to go to the hospital. So we put the care plans together. We do the assessments. We also, there's no obligation, no charge. We also will do home safety evaluations. Nice. So we'll go in, and it's like a 20-page document. We'll go perimeter of the outside of the home and every inch of the inside, identifying fall risk for families, modifications that they could make to help make their loved one be able to safely age in place, and everything in between. So I do those. Some of our other case managers do those as well. And then if it's memory care, we'll help put together a memory care program, because as you know, Dr. Raj, you've seen one person with dementia. You've only seen one person. It doesn't, like if somebody has diabetes, let's say, usually it's going to present itself the same in each person for the most part. Dementia will not necessarily present itself the same way. So we educate people. Your dad might be introverted and become, nonverbal, but your sister's husband, dad, father-in-law, maybe he was very extroverted and became the life of the party with dementia. That doesn't mean that's what's going to happen with your dad. So, we spend time and do a deep analysis of what, that person's going through and what their lifestyle and abilities are now with the dementia diagnosis, and put together customized memory care programs.
Introducing Meta Ray-Ban Display, the world's most advanced AI glasses. With a full color display built into the lens of the glasses, it's there when you need it and gone when you don't. Send and receive messages, translate or caption live conversations, collaborate with Meta AI, and more. Be one of the first to try Meta Ray-Ban Display. Visit meta.com/Meta Ray-Ban Display to book a demo and find your pair.
Oh, Hilton stay, oh, Hilton stay. Your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, oh, Hilton stay. A holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
So let me go off script on here, dude. So how do you market this? So are your main targets going to be the social workers for hospitals during that transition to discharge, or do people find you somewhere? Like you have a service that needs to be explained. So how are you marketing this?
It's going to sound bizarre.
It probably will, but
we truly don't.
Okay.
We've always grown by word of mouth. So
no kidding. Okay.
Yeah. It is sort of marketing, but we don't really do it for that purpose. Like I tell people, I'm not a salesperson. I'm not motivated by, finances. We'll do like a year-long dementia seminar at a local church, or, before COVID, we were going to dozens and dozens of senior centers, but not just one-offs. We would commit to them and come, monthly. And we'll do games. We'll do like silly bingo, or we'll do a silly auction, or we'll do lunch with Elvis. We never really generated a lot of business from that, because most senior people, they don't ever acknowledge easily that they need help, right?
Yeah.
They're holding on to that independence. So we're building up good faith and goodwill. Like, we're not just here today and gone tomorrow, which I think helped to, really build our reputation. But mostly we're word of mouth. People know us. We, in Livonia, where we're located.
Yeah.
We're a landmark business because we've been here for so long. So it's just people telling other people, really, or people that know us. Yeah.
Yeah. Wow. And by the way, so you guys are like, I found out like 20, they're not far from Detroit. You guys do things in Detroit too?
We've done several things.
Okay.
We've
My heart
had
goes out there. I
things.
did so much training in Detroit.
Yeah. I did. Well, when I was doing my ride-alongs, I voluntarily chose to go down to receiving in those hospitals because that's what you want to see. You know, I mean, I forget what the stat is, but leading gunshot hospital and all this and all that.
Yeah.
The only time I did get, I'm going to go off script for a minute. The only time I did get a little freaked out was if you've ever seen that show Scared Straight, right? I felt like one of those kids. One of our ride-alongs, we had to go to the Wayne County Jail.
Oh, really?
And do you remember ever seeing it?
Oh my God, yes.
Oh,
yes.
And we had to go in there, get a patient who, is having issues with his insulin and sugar. And I remember going in, you get searched even as a paramedic student or paramedic, and they open those gates, those bars. And I like that sound. I still hear it. They shut them behind you and you're inside with them. And here this clinical rotation, I was learning to do my IVs. Well, I get the biggest of the biggest guy. We get him onto the ambulance. And, I'm perfusing just from nerves. And I'm like, sir, my hand is trembling. I'm like, I have to give you a little poke. It might hurt. I apologize. It was terrifying. It was very intimidating. The guy was very understanding and nice, but I watch a lot of movies when I was younger and I'm thinking, okay, this is the guy that's breaking out and he's going to jump up and, so that was quite the experience, but I never worked as a paramedic. I only did it for the certification and training. And then I worked in the hospitals. I worked in cardiac critical care for a while. But my heart was always inside rather than on the road. So, but you had to go through that to pass the courses.
Oh my God. Well, one quick side note. So in LA, I was part of USC LA County, and the jail is underneath the hospital. So we get consults there. So the first time I was doing a consult in the jail, you go under the ground. It's all secure. It's the claustrophobia. Because when they lock the doors, they're sealed. They're not bars like in the old Westerns, like, hey, my hand goes through. And they closed it. And I was in there with my fellow. And you're right. You start thinking about all these movies. Once its door doesn't open, this is not good. Oh, my God. So I feel you. That story you told me, I feel you.
Yes.
All right. So, hey, let me ask you about this. This is something that definitely impacted everyone. How did COVID impact your company?
Yeah, so it's going to be a little longer answer because it's kind of two parts.
Yeah, tell me.
Well, I had mentioned, we used to go all over Michigan doing these community events and support groups. We made the conscious decision about a week or two before the governor made it law where, no public gathering. Our company obviously continued to operate being essential. But I miss that part of being able to go out and just talk to people, see a smile on their face and say, somebody saying, thank you, that was great. That's really going to help. And I'm a social person. And as far as the staffing, we were very, very fortunate. Anybody that's had a business during COVID hopefully didn't, but a lot of them they lost their entire workforce because it was so very easy, really any reason to get that money, that, PPP money, to go off work, childcare issues, this issue, whatever. We only lost one person the entire time of COVID. And believe me, it was voluntary by her at the urging of her children because she was in her mid to late 60s. And, they were terrified, like most of the country. Mom, we don't want you going places. And, but we knew another company that the family ended up hiring us because they had their mom in assisted living, and assisted living said you had to have outside support. that company's employee was there with this woman, and over their PA system, it said, please return to your rooms. We have a report of a resident testing positive for COVID. You have to isolate. That caregiver for that company got absolutely terrified. And she told this poor woman, she goes, essentially, honey, I'm sorry, but I'm leaving.
Oh,
and
wow.
She left. The family called the company and said, what is going on? And they said, we are so sorry. We don't have any staff, zero. Family hired us. So I've always said we were just unbelievably fortunate, because it's like starting your company from over. You lose your entire roster of employees. And so that we were very fortunate. And we went around, we had yard signs made, like, caregivers are superheroes, you're the, all these cool things. I mean, but that wasn't anything unique for us, Dr. Raj. I've told people what we do is and I think I said this to you yesterday, they're the low man on the totem pole if they go anywhere else. But in home care, they are. I mean, they're the attending. They're the top dog because they're in charge, right? And we remind them of that. We treat them in that manner, and we really take care of them. So every week, our staff, like our office staff, we were getting gift bags and going around to every employee while they're on shift, giving them a big bag of goodies. And it wasn't just random stuff. Part of our hiring process, we give them a document with like 20 questions. What's your favorite food? What's your favorite movie? What do you like? All these things about them. So we use that in the future when we want to do these nice gestures. So it's something meaningful to them. It's not just some,
generic
here's a
bag
cookie,
that you hand
generic, right?
That's
it's
awesome,
something that's going to, and the other impact was, because we stopped our public gathering, I wanted to find a way to continue getting resources and information out to people. So I told my wife one night, I went to the track by our house and I was listening to a podcast, really didn't know anything about them, and went home and said, I know what we could do. We should start a podcast. And she's like, what do you know about a podcast? I said, nothing. So we spent several months researching it, and then we launched it. And, here we are 5 years later.
Man, it's been 5 years, been doing this all
in May.
Matters.
In May. It'll be 5 years in May.
No kidding.
May of 2020. Yep.
Dude, I love that.
Thank you.
All right. So since you brought up, what was it called? I think you're like reading my mind. I was going to ask how long the podcast has been around. I'm going to jump to this one. So, you want to be a doctor first. You now have this awesome company. You're helping people and, modifying things during the pandemic. When did you and how did you become known as this senior care influencer? How did that come about?
Well, it was not my own doing because, believe it or not, I don't like to be like publicly seen or heard. I don't really have much choice now. But one of the leading, I say godfathers, but it's a woman in the industry. Her name is Lori LeBay. She's been doing this since like the early 90s. I mean, way before it was a cool, trendy thing to do. And when I kind of got her seal of approval, she says, I look at you, she's talking to me. She says, I look at you like you are the senior care influencer because I'm involved in so many different things.
You are.
And it's like, and I'm like, wow. She goes, that's what you need to be known as. And I said, okay. And we just kind of gone with it since then. And, a shout out to Lori. She's unbelievable person. I mean, she's been recognized by everyone and anyone. Got recognized by Maria Shriver for her work on dementia. Yeah, she has the show Alzheimer's Speaks. And I'm fortunate that she's now a co-host with me on Conscious Caregiving with L&L. And I tend to gravitate towards people that are real and legitimate. And you know what their motives are, right? Yeah. It's not just for the accolades and getting their name out there. And she's one of the most humblest people. And I tell her she's on the Mount Rushmore of dementia for me. I mean, she really is.
That's amazing, man. But, I always want to do something for the listeners like you do on your podcast. So since we got you here, I think it'll be very valuable if you can give some tips that you can share for family caregivers that are watching, listening to us right now.
Yeah, absolutely. My number one tip is if you need help, ask for help. But then also the one thing to know is you're not alone. I know like when I went through my experience with my father, none of my peers had a clue what I was talking. Like, you can share something with somebody. Like, you could do surgery tomorrow and you could tell me about it. I've never cut anybody, like I would be like, wow, that's amazing. But I can't appreciate it till I've done it. I equate it, for me, the best way to equate it, when you're expecting your first child, right? Everybody tells you it's going to change your life. It's the most incredible thing ever. And you're like, yeah, I know. But you really don't until you're holding that newborn baby, right?
Well said.
And I think that's what it's like being a family caregiver. Nobody understands what it's really like until you're in that position. But I tell them, you're not alone. There are millions of us out there. Look for your support. Attend a caregiver support group, either in person or virtually. Contact your local area agency on aging. Find out what resources are available, or your local senior center. And then the number 2 tip, maybe even number 1, they can go back and forth. Take care of yourself first. Don't neglect your physicals, your checkups, your dentist, your, whatever it is. You got to take care of yourself so you can take care of your loved one.
And it's, my mom, because my dad passed away, now my mom's going to be moving into this house where I'm doing this interview at. I'm just asking her, hey, what about your health and this and that? So anyways, I'm like, hey, you know what? She said my right eye is not doing as good. I'm like, why didn't you mention this to me a long time ago? And it was because the focus was dad. So I brought her to the optometrist, a horrible cataract that she could have taken care of, but she just dealt with it because dad comes first. And you nailed it. You have to take care of yourself. You know what I mean? Right. So I loved your tips.
Thank you.
But can we do these tips now for things that you could share for home care companies?
Yes.
What would you tips for those?
This really the number 1 tip, and it's going to sound so elementary, but if it was simple, everybody would do it, right? Honesty. Honesty is my number 1 thing, hands down. And I'm going to tell you why. We interview countless people every week. Some I'm a part of, some I'm not. It just depends. But really the number 1 theme, I would say 9 out of 10 employee candidates that come in, they look at you skeptically. They, and they say, well, that's what the last employer said. Do I really have a job if you hire me? And I'm going to dive into what that all means. So we interview Linda. Linda says, well, yeah, I am currently employed. So we'll say, well, why are you interviewing for this job? Because I need the work. Well, but you just said you're employed. Don't you have any hours? Well, they hired me last month as a full-time employee, but I'm still waiting for hours.
Yeah.
And, or they promised me X, Y, and Z, but they never delivered. I say sometimes in a very nice, fragile, soft way, we're us, not them.
Yeah.
You are you. You're not the last employee that said they were going to take the job and then just disappeared and we never heard from again. We're giving you a clean slate. Give us the chance and a clean slate to prove ourselves. We not just, we practice what we preach. We're not just saying it. We actually do it and we back it up. Like we have employees that have been with us on average 10 years.
That's solid.
We're not,
job.
Especially in this industry,
exactly.
Yeah. And so they get schedules and they say, well, what's my schedule going to be the following week? And what that originates from is a lot of home care companies, and they have their reasons. They will give you a different schedule and a different client, like every other week or every other month. You don't have a consistent schedule. Well, we'll use you as an example. If you had a patient and, you're treating them and you're sitting and hearing their stories and their issues, and then the next time they come in, they're meeting with one of your colleagues and it's like starting all over again.
Yeah.
You can't build up that relationship and that camaraderie and that trust, right?
Yeah.
And so it's the same with caregivers. A lot of companies, what they do is they will mass hire people, mass put your own number on it, but they will hire a multitude of people. They will tell them they got the job, they got all this. And the reason why do they do that? Home care is unlike any other industry. You don't know when you're going to get a phone call for that new client that you're going to bring on board.
Yeah.
So if you call and said, hey, Lance, we need you to help take care of my aunt. She's dealing with this. Okay, we'll do the intake. Okay, when can you start? Well, we don't just have people sitting around our office waiting for the phone to ring to go out and work. So if we don't have, with our existing roster of staff, if they don't have somebody with the availability to meet your needs, we're going to have to hire from outside the company. right? That could be a process. That could take a week or longer, especially in this climate. And so that's why these other companies, they just go and they'll hire people in volume. And then when they do get that phone call, they will go down the phone tree and contact whoever answers and whoever's still looking for work. But a lot of them end up just venturing off to find, because they have bills to pay.
Of course.
So we tell people, this is where the honesty part comes in. A lot of people in this industry have been burnt, they've been misled, they've been mistreated, and they have a bad feeling with the industry. We don't want to lose good, caring people and have them go work at Walmart or in a nursing home because they're like, I can't work in that area anymore, because they think the whole field's like that. So we start off, we may say things you don't like, but it's going to be truthful. We may say things that you love, that's going to be as equally truthful.
Yeah.
And we say, give us the chance to prove ourselves, just like we're giving you the chance to prove yourself. We're not going to associate you with the no call, no shows that we've had in the past, or, you're you and we're us. So honesty is going to take you so much further than telling them what you think they want to hear or what might be convenient for you at the moment. And I think that's why we've been the number one company in Michigan for the last 7 years.
I love that. And, you get me so pumped up, because I wish I met you during the times where I needed you, because it really makes a difference. When we had home care come to help out my mom, we pay out of pocket, you know what I mean? Yeah. And it really affects the patients. People don't know that we had sitters that came over and caregivers that came over that would just stay on their phone, on their cell phone. And I know my dad has dementia. You don't need to have a long conversation with them, but it just, when you do get the right one, the right fit, because you did a good job picking them, they interact, they make them happy. And people don't realize that the family wants certain types of caregivers, if not consistency and continuity. So I definitely agree.
Well, I'll tell you, Dr. Raj, this isn't to, toot my horn in any way.
Yeah.
But for me, this isn't just a business. It's actually like a calling. It's a mission. And like people will tell you here at the office, like, I know everything about every one of our people because I want to know. And like we had a sweet, wonderful lady. She's one that was in the nursing home, and her family was just so distraught, super tight, close-knit family, all sisters, and they only had their mom left. They said, is there any chance, that mom, and we said, well, what's going on? And we went to the nursing home, met with them. We said, there's no reason for mom here. There's no medical reason for her to be in the nursing home. This was more out of safety than necessity.
Okay.
Bring her home. We can take care of her.
Yeah.
Well, I'm a diehard. I know your dad loved the Lakers, right? I'm a diehard baseball fan. I'm a diehard baseball fan. And the Tigers made the playoffs. This woman was a Tiger nut. And now the Tigers aren't my favorite team, but I love baseball.
Yeah.
In the evenings, when I'm done at work, I would actually, several times, I went over there, sat with her, and watched the playoff game with her. The caregiver's there.
Yeah.
But, I knew that meant a lot to her. I had no problem doing it. I love baseball too. And it added so much joy. And the family would say, oh, we got, teary-eyed, because they would look in on the camera. They would see their mom and me sitting there side by side watching a baseball game. And they're like, this can't be real. Why aren't we taking that extra step for people? It's so simple. You used your Uncle Ben and Spider-Man quote yesterday. And I said, my favorite is, to whom much is given, much is required. What is it really costing me to go that extra step? I mean, I'm probably going to watch the game at my house. Why not sit there and make this lady's day a little bit brighter? And, it's paying it forward, so.
Yeah. And I'll just tell you one thing. It's being a role model. It's leading by example, because I'm associated with a assisted living company called Aegis, and they're more on the West Coast. But, when I, joined them because they asked me to be their chief medical officer, their presidents and vice presidents and all the people that are wearing these beautiful suits, they would go to the homes, to the memory care units, and they would actually touch the patients and be with the patients. And that's what really inspired me, because how can you tell someone to do something if you can't do it yourself? And I'm telling you, and no one knows what some of the dementia is till you see someone in their diapers, half naked, and that's taking care of someone, touching someone. And when I saw, people from Aegis do that, I'm like, this is where I want to be, because that was the part of my life after experiencing what I'm doing with my dad. That's the type of empathy I wanted to have. So your stories and you being a role model is what you need to do. And I believe you, because that's the people you're going to hire. And you're leading by example.
Yes.
I like you. I really do.
Hey. You need to come to Michigan. Come visit us.
Let me ask you one last question, and I'll let you go. Okay. Sure. So what do you want to accomplish? It's classic. What do you want to accomplish given the platform that you have? And you have a big platform.
My goal is for family caregivers to know they're not alone and that there is help and support out there for them. Because right now, very few and far between get that information when they're in that doctor's office or they're getting that discharge. They're going home and it's like giving me a car and saying, put it together piece by piece. I have no clue what I'm doing. That's how family caregivers often feel. And they're looking for that source of, how do I put this car together? How do I take care of my mom, my dad, my husband, my wife, my child with a disability? They need that support. So that's why I do what I do. So I'm hoping that eventually I won't need to do it.
I love it, man. All right. You know what? I think this is one of my favorite podcasts, not because I'm just talking to you and looking at you, because you're real. I'm going to tell all my listeners that Lance is the real deal, and it was a treat to have him here. And like I said, I wish I knew you just, maybe a year earlier. I think you could have made my life a lot easier, But hey, I hope everyone out there enjoyed this podcast. Lance, thanks for coming on today, bud.
My pleasure.
All right, dude. Everyone, I'll see you in a few weeks.
Thank you for listening to another episode of the Dr. Raj Podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep2Go, and you can learn more at medprep2go.com.